Hi, I'm Terry Farr with the Greater Picayune Area Chamber of Commerce, located in Picayune, Mississippi, where I'm the Executive Director. And today I'm very fortunate to be in Poplarville, Mississippi. As you can see, I have three guests today. It's going to be a little bit unusual, or a little bit different, if you will, that we do have three guests. I'm at the Pearl River County Hospital and Nursing Home, and they are members of our Chamber of Commerce, and also they are sponsors, and we appreciate that. But mainly what I appreciate is what they do for the county, for what they do for, well, not only just Pearl River County, but they're located in Pearl River County. So Steve, I'm sure we'll get more into that after a while, but I do want to thank y'all. And what I'm going to do today is a little bit different in that I'm going to introduce you to Steve, and then get a little bit of information from him, and then he's going to ask the questions. So I'm going to have the easy job today and sort of sit back and relax. So let me introduce Steve Reid, and then he's going to give some of his background, what he does for the hospital and nursing home, anything else he wants to do, and then we'll go from there. So
Okay.
Welcome to Chamber Conversations.
Thank you, Terry. We appreciate you giving us the opportunity to participate in the conversation today, and hopefully we'll inform the public about some things that maybe they didn't know about our hospital or our nursing home.
Good deal.
I'm a hometown guy. I grew up here in Poplarville. I've worked at the hospital since September of 2011, and I love my job here. I love what I do, and I want to thank Dr. Jones. Dr. Angela Jones is our nursing home medical director, and Dr. William McArthur, who is the medical director on the hospital side, and he also serves as the chief of staff here. So just wanted to thank these guys for coming in and being a part of this today. And one thing I like about the hospital is they encourage us to participate in community functions and clubs. We are a member of the Picayune Chamber. We're also a member of the Poplarville Chamber.
Right.
The hospital encourages us to be in civic organizations. I'm a member of the Rotary Club, have been the last 7 years, and James Williams, you would have had another person here today.
Yeah.
James, our administrator, is also an active Rotarian, and he serves in the Army National Guard. And James has been with us since 2017, June, I believe, and he recently got back from a deployment where he was over in Kuwait for a year, and today he's finishing up, tying up some loose ends with getting that deployment finished up at Camp Shelby. So, we're involved in a lot of things in the community. With the Rotary Club, we're active at the Blueberry Jubilee. We do the cancer walk each year. We're active in the Women's Health Symposium. A lot of people probably don't know that, but when you think about the hospital and nursing home, I think a lot of people may think it's just a nursing home or may think it's just a hospital. Like Dr. McArthur and I were joking earlier, I think there's some people that don't even know there's a hospital there. So that's
I have heard that.
That is a part of our purpose today, is just to educate the people that were here. On the nursing home side, we are a 120-bed nursing home. I've always heard great things about the nursing home, even when I didn't work here. I've had family here, grandmother, aunts, and they all received great care. The hospital side, swing bed is what the majority of the folks that receive treatment are here getting. Maybe not everybody knows what swing bed is. It's basically skilled nursing care. We don't have skilled beds in the nursing home. They're over on the hospital side. And Dr. Jones and Dr. McArthur provide care for folks that are needing skilled care or swing bed. And probably the main thing that we want to get out there, the message today, is to let people know that if you're in the hospital due to a medical condition, a fall, an accident, anything, and swing bed is in your future, if you need that inpatient rehab before you go home, if you need to get stronger before you go home, you do have a choice to return to Poplarville, to Pearl River County Hospital for that swing bed. And if you think about it, for anybody that lives in Poplarville, or if they live in Lumberton or Carrier, this is a very convenient location. It keeps their family off the road. They can come here and visit. They'll get just as good a care here as they would anywhere else. So we want people to know that they do have a choice. Wherever they're in the hospital, it doesn't matter. If they're in Hattiesburg, Slidell, wherever, their discharge planner there, or case manager, social worker, what have you, they should talk to them and let them know what their options are. But we want them to know that they can ask them, they can request to return right here to Poplarville. There are a lot of things, there are a lot of services here at the hospital that people may not know about. We do wound care here 3 days a week. We have a lab. We have outpatient rehab, and the same thing goes for outpatient rehab. You can choose to return here. Last year I popped a bicep, had surgery. I chose to come here to get my outpatient occupational therapy. As you can see, I can use my arm again. So they do a great job here.
Was he flexing that bicep?
No.
Oh, yeah, yes, indeed.
No. We have an emergency room here. We're a level 4 trauma center. Our job is to treat people, get them stabilized, and get them on to a higher level of care if need be. We do telemedicine with UMC. That means we have the setup. We can see the providers in Jackson. They see us, and they can advise us on how to stabilize those patients. And one of the newest things that we have here is Tulane recently put a Telestroke Robot in our ER. So if someone comes in with stroke-like symptoms, as soon as we put their name into the system, we have access to Tulane's experts. We can see them, they can see us. There are cameras there on the robot. We have a CT machine here. We also do x-rays. We have a radiology department at Farr County Hospital and Nursing Home. They can upload the CT scans, and the docs there in New Orleans can have a look at it and advise us on our next move to get them stabilized. So there's a lot of things here that we have. We have a rural health clinic right down the highway there at 302 Highway 11 South. And and sometimes there's a little confusion with that. People see the building over there, and it's Pearl River Family Clinic and Behavioral Health. The front building is the family clinic. Behind it is where the little behavioral health clinic is located. And we do outpatient behavioral health there, serving people of all ages. We see kids and adults. And soon we will be reopening our intensive outpatient program, which we ran here for several years, and we're excited about that. That program is primarily for people age 50 and older that are having any issues, any behavioral health issues, and usually it's depression, anxiety, things of that nature. So we're excited about that. But one thing to say, in addition to all of the services that we offer treatment-wise, the resident care that we do here, the hospital and nursing home is also a great educational center, because you look at the opportunities that we offer to people here in the community, starting right here at the high school. You got allied health classes. My buddy Todd Smith has a class there, and he brings students over here that are interested in a career in healthcare, and they get an opportunity to observe and shadow and see some of the things that are going on. And then right here at Pearl River Community College, their nursing program, they come, they round here. We have interns from multiple places that work throughout the hospital system, here at the hospital and down at the clinic. It's a routine to see interns from lots of different places. I recently took some photos of some that we had here from the University of South Alabama. So there are a lot of things going on here at the hospital that people just may not know about. And we appreciate you giving us the opportunity to talk a little bit about it. So
I had no clue y'all did all that. It's almost like, what do y'all not do,
That's right. That's right.
Y'all
So
got it going on.
we do. And again, we have our nursing home medical director here, Dr. Angela Jones, and she's a hometown girl. We're happy to have her here with us. And Dr. Jones, is there anything that you'd like to add to the video?
I've been on staff here since 2003, and so I have about 70 nursing home patients. A lot of those are my patients from outpatient clinic who've just graduated into the facility. I also admit to the swing bed, and a lot of my patients, when they go in with knee replacements, hip replacements, etc., I tell them, as soon as you get through with your surgery, you tell your surgeon you want to come back home. Our PT, OT, speech therapists, I would put them up against anybody, anywhere. Quality care. Some of these nurses at this facility have been here since I've started, long time, long even before I do. And they're hometown folks, and they provide wonderful care. My own mother was here for 3 months rehabbing, and is now back to her baseline. So I admit my friends, I admit my church members. It's hometown care. It's compassionate care, and we get you well. We get you back up and going. So
That's a good deal.
That's right. Thank you, Dr. Jones. Dr. McArthur, he's not from here, but we kind of adopted him in. He's bought a home here, so He's one of us
He's
now.
here now.
That's right.
Yeah, that's right.
So Dr. McArthur serves as our medical director on the hospital side, and he's also the chief of staff here at Pearl River County Hospital. So,
And he's had a long day today.
he has.
Yeah, and I appreciate y'all having us to talk about our services. And Dr. Jones is right. Our therapy department is excellent. I feel like our emergency room staff is really excellent too, and they've adopted these telemedicine and telestroke programs. We used the telestroke program yesterday, as a matter of fact, got a young man to Lakeview very, very rapidly. He was having a stroke. So I feel proud of what we have here, and it's important that people know about it.
That's right.
Just this past week, our reputation at the nursing home of being a high-quality nursing home, I've had people from Hattiesburg, Lucedale contact my office saying, I want to put my mama, I want to put my grandmother here.
That's
just
right.
because of the quality of care.
That's right.
Well, I know one thing. I've heard one of the supervisors, and you may know who I'm talking about, at least 2 supervisor meetings brag about the hospital, and evidently he feels like he's alive because of y'all, and so he's bragging on you.
Right. And we enjoy a lot of support from our Board of Supervisors. We have a great team here on our Board of Trustees.
Right.
That's helping us here at the hospital. So just great staff all the way around, and this is Poplarville. We're Poplarville's hospital. As far as the nursing home goes, like I said, I've always heard good things about this nursing home, even when I didn't work here. When I marketed and worked for a partial hospital program before coming here, I always heard good things about Pearl River County nursing home. And then with the hospital, the ER, the community is so fortunate to have this ER here. There are many people out there, friends of mine's parents, who, had they not made the stop here, they wouldn't be here with us anymore. And in an accident or in any emergency, minutes count. And having that Telestroke Robot here is just, it's awesome, because, especially in a stroke, those minutes are going to dictate how well they recover. So we're very fortunate to have this hospital. I'm very happy to work here, and more than anything, we just wanted to let the public know, if they've watched this point. I know we've talked a little bit, but hopefully they will watch it to the end and know about all these services that we have here.
Let me make a recommendation to the listening audience too. If you've never been to the hospital, come pay a visit. And I don't know if you get tours or whatever, but come pay a visit so you will know this is a big place.
We actually do have prospective nursing home patients come, or their family members come and take a look around. One of my favorite things that they get to see are the murals that have been painted on some of the areas of the ceiling. It's really neat, the artwork that's in the nursing home.
Maybe they need to come visit before they really actually need your services.
Right, make that decision.
That's right. That's right. Well, thank you for this opportunity. Again, we just wanted to make the public aware, and more than anything, we want them to know whatever hospital they end up in, they do have a choice to return right here to Pearl River County Hospital. Just let your social worker or discharge planner know that, and after a 3 midnight stay, they are qualified to return here. So keep us in mind.
It's also a good place to work.
It is.
We're one of the largest employers on this side of the county. I think we're behind the college. So if you need a job, it's a great place to come up here.
Most
if you're a
people
nurse.
don't realize what kind of economic impact y'all make on the county, so we need to keep it up and running.
It's tremendous, the economic impact. What I mentioned going out into the community, I recently was asked to speak to the Historical Society here in Pearl River County about the history of the hospital and nursing home, and it goes way back. But one of the things that I researched was just the economic impact that it has here, and I believe we employ over 300 people when you look at full-time and part-time folks. So it's very big.
All right. Well, listen, I appreciate y'all letting me come up here and visit with y'all, and don't guess anybody can see me, but so anyway, we appreciate y'all, and just y'all have a great rest of the day.
Thank you, sir.
Thank you, Terry.
Thank you.
All right.